Hello, we will consider today the levels of prevention. This is part of the PSM lectures for MBBS students and DPharm students. So, levels of prevention, we will just first consider levels. Levels of prevention. Primordial. Primary, secondary, tertiary. So, these are the levels of prevention. Prevention of disease. Prevention of disease means how to prevent disease. We think that in our mind, it first comes that prevention of disease means just to prevent disease occurring. But there are certain levels of prevention. In the old park, there were primary, secondary, and tertiary prevention only. The old park, primary, secondary, and tertiary prevention of disease. So now in the new edition, there's a primordial prevention also. It's a primordial prevention. So we will see what is primordial prevention. Primordial prevention is preventing disease before it appears. Preventing disease before it appears. That means there are certain conditions in the modern society, just like hypertension, diabetes. So prevention of this illness, symptoms of this illness before they occur. When the symptoms occur, we people go to the hospital and get treated. But primordial prevention is you detect certain symptoms early and prevent that occurring. For example, this hypertension. Hypertension occurring, the new generation, they have sedentary habit. So every child is told by the father and mother, you go to the professional college, engineering or medicine. Don't go and play with other children. That's what they are told from the beginning. So they sit in front of the TV for some hours, eat some fatty fried foods, and there is no exercise, and there is no exertion of the muscles. And see, their muscles as they exert, according to Starling's law, the muscle more and more it contracts, it gains more and more power. So these children are made to sit in front of the TV for some hours. Usually they are living in flats and small houses in two cents, so that there are walls just near to the house. There's no absolutely no space for running, or so their muscles are not exercised, and after some time they become obese. Obesity leads to atherosclerosis, and when they grow up, there's chance of hypertension and heart attack, paralysis, etc. So to prevent that, then other things are hypercholesterolemia, etc., which lead to thickening of the arteries. So to prevent these things before they occur, that's detect early hypertension in the society, and weight. That's age for age and height, and that it detects early obesity and prevent that, and help giving health education to the father, mother, and children about these factors. That's a primordial prevention. Next is primary prevention. Primary prevention means it's two components: health education, health promotion, and self specific protection. Health promotion and specific protection. Health promotion, specific protection. This health promotion and specific protection. Health promotion means their balanced diet, exercise, good environment, cleanliness, and especially give children are given a protective diet. Usually now it is given in the Anganwadis all over India. Anganwadis give all the daytime meals there, that the health promotion is there, and they give health education for the others so that they can give their children good diet, exercise, etc. Health promotion. Specific protection means vaccination. Vaccination. Vaccination means immunization schedule. All our children all over India are given immunization schedule free. National immunization schedule free. There it is prevention for that TB, BCG, polio, oral polio vaccine, then DPT, diphtheria, pertussis, tetanus, and measles, mumps, rubella, then tetanus in the adults, Haemophilus influenza meningitis, and German measles also can be prevented. So these are specific protective vaccines are given in different life ages all over the India. Primary prevention. Secondary prevention means early diagnosis and treatment. Early diagnosis and treatment. When the once the disease occurs, it comes outside, and people go to the hospital to relieve the symptoms. So early diagnosis with minimum investigations. Just like in outside countries, they are all insured. They give blood and all tests are done, and then only they go to the doctor. But here in our country, India, not being so advanced and so much expenses cannot be met free. So doctors with higher skill, clinical skills, who can detect, diagnose disease without with minimum investigation, will provide good secondary prevention. And early diagnosis and treatment. Treatment should be adequate, and it should be to the point, that accurate diagnosis and treatment for that only. That gives a country like India much economic relief. Next, tertiary prevention. Tertiary prevention is once a disease has occurred, then it is some disability, the late diagnosis and the late treatment, etc., makes a pathology, some pathology to occur in the people, and they have to be given tertiary prevention, the disability limitation and rehabilitation. For example, in paralysis, that disability should be limited by exercise, physiotherapy, and rehabilitation. Rehabilitation means they have to be reintroduced in the community. They have to gain self-confidence. They have to provide for themselves and care for themselves, at least in some percentage lower rate by subsequent consultation and treatment like physiotherapy. Some psychotherapy also may be needed, and some economic help or some other occupation. These are tertiary prevention, so that they are functioning as a normal individual in the community. So these are the levels of prevention. So this is comprises total care of the individual, not only treatment of the disease, but in the community's health as such is improved. That is levels of prevention. PSM lectures. Medical students and DPharm students can uh, review this within 5 minutes, so that about 2 hour lecture is condensed into 10 minutes. This is good for revision also. It will remain in your mind. Thank you.